Hi, my name is Kim, and this is Lauren. She'll be helping me out today. I'm an athletic training student here at Seton Hall, and the movement that we're working on today is foot supination. The main muscle involved in foot supination is going to be your tibialis anterior. Our next exercise is going to be called ball squeezes. It's going to be our isometric exercise. We're going to be working our supinators in the sense that supination is a mixture of inversion, plantar flexion, and adduction. And so what you want to do is have your patient short sitting with good posture. Ideally, you would use a ball that's air-filled, but what we have here is a medicine ball. So you want to place the ball in between their feet, have them come into a little bit of plantar flexion. Sorry. Have them come into a little bit of plantar flexion and instruct them to squeeze the ball with the insides of their feet. You can have them hold it for 15 seconds 3 times, and then you can progress the exercise by increasing the resistance, like having them squeeze something that's a little bit more solid, or you can have them hold the squeeze for a little bit longer of a duration. Our next exercise is going to be our isotonic open chain exercise. We're calling this one resisted foot supination. So what you want is have your patient long sitting with their foot and a little bit of their ankle off the edge of the table. You want to grab a resistance band with a loop at the end, wrap it around their foot so that it's comfortable. Have their foot and ankle in a pretty neutral position, whatever's comfortable for them. Apply a little bit of resistance while stabilizing the leg and instruct them to supinate the foot. So bring their big toe closer to their other leg or closer to the opposite direction that you're pulling. You can have them do this in 3 sets of 10. To progress it, you can increase the resistance of the band, or you can increase the sets and reps depending on how they need to progress. Right? Yeah. All right, so our next exercise is going to be our functional close chain exercise. With something like this, working pronation and supination together, you're going to get more of an overall natural movement. So for something like this, you have your patient standing. You can have them with their shoes off or in socks, without socks, whatever is going to be the safest for them in the environment. You're going to instruct them to step and jump towards each cone. So you want them to do like a skier type motion without the slide board. So you're going to have them nice and ready position. You want them to step over and shift their weight over to the first cone. You have them step on the outside or the inside of the cone, depending on what you want to be working, right? And then after they're there, planted on one foot, doing the other side with the other foot, right? So we shift their weight, jump over to the other cone. So you can use the cones as both a visual and a tactile feedback if you have them step on it, and you have them keep doing this through all the rest of the cones. You can have them, depending on where they are in their rehab, you can have them progress by doing more cones or just going forward and backwards. You can have them going like just forwards, going up and back, whatever really works for your patient in this case. So with the both eccentric and concentric contractions, you're getting more of a complete workout of like foot supination.